everybody. Today I'm going to show you how to utilize a Carpuject. So first, we have an order for morphine at 1 milligram IV push every 4 hours for pain. So I'm going to perform my first check at the Pyxis, and then I'm going to perform my second check in the medication room. And this is where I'll show you how to utilize the Carpuject. So I've obtained my medication. This has morphine 2 milligrams in 2 milliliters. So I'm going to insert the medication into the Carpuject. I'm going to lock it, so twisting the blue, and I'm going to take this knob and I'm going to thread it 5 or 6 times into the medication. So because I only need 1 milligram in 1 milliliter, I'm going to have to waste 1 milliliter of medication, and it is a narcotic, so I'm going to need a nurse as a second witness. So I'm going to dispose of the 1 milliliter in the proper receptacle. I'm going to remove the air bubble from the medication first, and then I'm going to dispose in the proper receptacle. So now I have the 1 milliliter and 1 milligram of morphine. And now I'm ready to perform my third check in the patient's room. So I enter the patient's room and I perform hand hygiene. I check my third check of the medications with the 2 patient identifiers, and I'm checking for allergies as well. I'm going to check for the IV site, see if there's any redness, swelling, pain, and everything looks fine. So I'm going to unclamp it. I have my flush. I'm going to prime it. I'm going to alcohol the port for 15 seconds, and then attach my flush. So I'm going to aspirate and pull back, checking for blood return, and it looks like there is, so I'm ready to flush 5 milliliters. So I push 5 milliliters. And I can remove this. And now I'm ready to apply the Carpuject. So twist this on. And I'm going to be pushing the morphine 0.5 milliliters. So I'm going to push everything through. Because this is 0.5 milliliters, I want all the medication to go in. I can wait 30 seconds, and while I'm waiting 30 seconds, so I have 0.5 medication inside the patient already, so I have to push the last 0.5 with the flush and wait 30 seconds, and then I'm going to push the rest of the flush in, and as I'm doing so, I'm going to clamp so there's positive pressure. I'm going to remove the flush, and I am going to document all of everything I did. So now I'm ready to dispose of the medication in the Carpuject. So it's locked right now. I'm going to twist it to unlock it, and then I'm going to twist it, the knob, to unthread it as well. So I can dispose of the medication in the proper receptacle, and I'm going to take a cavi wipe and wipe down the Carpuject. And that is how you do it. Thank you.